I have had a long-standing association with Myanmar, in particular in relation to healthcare, and have visited Myanmar on a number of occasions in recent years at the invitation of Darzi. In 2013, I advised her on plans to redevelop Rangoon General Hospital and reform the Myanmar health services. And I'm also a trustee of a charity which has provided training, equipment, and developed a new curriculum for medical education. I later joined an international forum she established, which was intended to monitor the restoration of Rakhine State and return of the Rohingya Muslim refugees. Sadly, that failed, but my most recent visit in 2019 to assist with the release of the two Reuters journalists detained while covering events in Rakhine was successful. Earlier in the year, I wrote a piece in the BMJ as we saw doctors as targets of the brutal crackdown by the army and the police in Myanmar, as leaders of the military junta seek to silence the countryside and protest against the military coup. Now, 9 months into the coup, the emergency in Myanmar has evolved into a protracted crisis. Access to healthcare is being severely impacted as part of the Myanmar military's blanket offensive against the anti-coup movement. Many healthcare workers and volunteers are being targeted and intimidated in the course of providing medical care to those injured in the course of political violence and the growing conflict. We have heard numerous reports across the country of doctors and nurses being served with warrants and arrested, and healthcare workers being injured, while ambulances have been destroyed and health facilities have been raided. There is no real support system for management of COVID, neither intensive care nor any proper vaccination program, low testing rates, and high vaccine hesitancy. Furthermore, there have been widespread instances of health supplies which are confiscated, critically affecting COVID-19 treatment and oxygen supplies during the third wave, which spiked between June and August of this year. I know many of these doctors, and the arrest and detention of medical staff is an affront to doctors everywhere and a clear breach of humanitarian law that demands an ongoing and a robust response. It is vital work that we continue to work in partnership with the BMA, GMC, UK Medical Royal Colleges, the NHS trusts, non-governmental organisations and academic partners, as well as members of the Burmese diaspora working in the NHS, has to actively support our colleagues in Myanmar. Initiatives such as the provision of clinical guidance resources and the delivery of practical webinars and virtual training sessions are immensely valuable tools to impact life-saving knowledge and skills. We need to provide to ensure the continuation of medical education to the next generation of doctors and healthcare workers, both financially and also in the development of online degree curriculum and practical training of trainers to facilitate dissemination of exemplars of good clinical practice. And those who believe in democracy, the rule of law, and universal human rights, we must come to the support of our colleagues in Myanmar, doctors, nurses, and medical staff who are risking their own lives for the country. It is essential that we continue to exert pressure and ensure the ongoing situation in Burma returns back to the forefront of international media stage.